This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, I want you to know that Dr. Molly and I are in our beach attire. We're ready for the day, all right? Because that's what it's going to be, a hot beach day.
It is.
Good to have you with us here on Health Watch, Sundays 8 till 9. Talk Radio 1210 WPHT. What do we talk about here? The clue is in the title, Health Watch. We talk about you and your family's overall health picture, and we do that with Dr. Molly Fantasia, of course. And we go over all of the situations and issues pertaining to what Innovative Medical Associates does, how they do it, why they do it, and when they do it. And, of course, you're always welcome to call in with questions at 855-839-1210. That's 855-839-1210. Health Watch again every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And, Dr. Molly, it's always interesting because you have people coming in all the time from other parts of the country.
It is true. And I have to really thank my staff and lovely Linda today and Barbara, who is, of course, one of my, actually my right-hand girl in terms of nursing, and Linda, who's my right-hand girl. So I'm lucky enough to have two right-hand girls who are filling in for me right now while we're on the radio to do this live.
And so Innovative Medical is open.
It is open today, and I will say that the core group here, we worked probably 7 days, probably in the last 2 weeks, both weekends. So it's just been a very interesting couple of days between COVID, post-COVID, between our traditional patients, autoimmune, and cancer supportive care. We haven't stopped, John.
And it's interesting because you have people from all over the place.
Yeah,
we're going to talk
Florida.
about what you do.
Yeah.
Somebody this week I saw from Florida.
That's right.
And Indiana. And they've been in from California.
Of course, yeah.
And so on and so forth. So they come from all over the place.
They do. And it takes a little bit of time. It takes a little structure. And it's all about how you utilize the space that we have. And we try hard. That's all I can say.
All right, let's explain for those who may be listening for the first time that Innovative Medical Associates is what? What is it and what's different about it?
Innovative Medical Associates is a cooperative of like-minded healthcare providers who perform their services from our licensed medical facility. So we have a facilities, primary care facilities license, like you would if you went into a hospital outpatient department, that kind of thing. So we can do anything a primary care or a family practice could do for a patient. You need an antibiotic, we can give it to you. You need blood pressure medications, we can give it to you. You need to be followed up by one of the specialists, we can send you with a referral. Bottom line is this, though, we believe that the best way to help a patient improve their quality of life is to use the least amount of pharmaceutical necessary to help a patient get through their medical condition and keep their quality of life.
And how many times have you've seen it in your career where you get a prescription and then it has the side effects and then you'll get put on another prescription to counter the side effects, and then you'll have another prescription to counter the counter. And now here you go. Now you got 5 prescriptions.
Right. And here's the thing. The thing is, we do not believe you don't stop your pharmaceuticals. You need a pharmaceutical, you use your pharmaceutical. But the bottom line is, if we can somehow reduce the side effects, we've already made step one in improving your quality of life while going through whatever challenge you're going through. And that's the key, John.
And let's talk about hydration, because that's the cornerstone of what you do.
Yeah.
So the hydration is the
vehicle by which we're able to deliver nutraceuticals in an appropriate amounts in the right constituents. I'm able to extract the constituents that actually have medicinal qualities, and that's the key. So, how many times you going into a health food store, pointed your way to an aisle, and there's a million remedies, so to speak, in that aisle for a particular challenge. Which ones do you pick? Hopefully you get a knowledgeable guy. Like, I have a patient right now who owns a very well-known health food store. He's extremely knowledgeable. I love this guy because it's wonderful to work with him. He's extremely knowledgeable. But how often does that happen? Not very often.
Very little, yes.
Very little.
Yeah.
And, we're going to find that's going to happen. It's going to happen less and less because of how many corporate entities are buying up the health food product right now. That's a big thing. I'm on it. That's a very big deal because you're going to see less and less true health food products out there that have the research to go with what they're doing. You can be sure the large conglomerates that are buying these companies are not going to probably, you would hope they won't mess with a good thing. But I don't think that's going to be true.
No,
because
they're there to make money.
They're going to be very driven by the money.
Right, exactly. The hydration, that's the way you deliver.
That's right.
The nutraceuticals that you...
For the most part,
For
yes.
the most part, yeah. I had somebody the other day, I'm sitting there getting my drip.
Yeah.
And they said, well, your bag is orange and mine's yellow.
Yep.
I said, well, they're all different. Now she's asking me questions that
That's
usually
right.
come to you. And she said, well, what's in them? I said, well, everything is different.
Right. There's some basic stuff that you want to do because you want to make sure a patient is safe. So there are some things you put in that change pH, those kinds of things. Leave that to us, okay? There are some things that we generally put in to make sure that the IV or the hydration is comfortable for you, and that's what we want. And look, this week I had a very interesting case. A young guy came in, he looked very healthy, well built. He had great muscular definition. He comes in and goes, hey, I want one of the yellow bags. I said, you do? Yeah. I said, how do you know about those? He said, oh, well, I had them before. I said, and when he left, by the time he left, he said, I'm coming back to you because I like what you gave me. I felt it immediately. I said, thank you, sir, and I appreciate that. His bag was yellow, but it didn't feel like anything he ever got at a spa.
I'm sure. And the same conversation I was having, and the person said to me, how do you know, how do you know what's for what? I said, well, Dr. Molly has over 600 protocols.
Yeah, it's hard to believe.
Right. And she looked at me like, what? I said, yeah. I said, probably now much more than what I knew before.
Well,
so you do have over 600.
I have a lot of protocols. And again, they're condition specific, but you can't even say that. You've got to say that they're specific for a particular patient,
right,
as well as the condition that we're trying to help a patient with.
So even if I have a yellow bag and the patient
Doesn't
across
mean
from me has
that
a
they're
yellow
the
bag,
same.
that does not the same thing.
You may have one constituent that makes it yellow that you both have. Doesn't mean it's in the same amount. It may be in a different strength. I have various strengths. For example, I have 3 and 4 different types of B vitamins. I have 3 different types of complex vitamin B. So, heck, we use different combinations for different things. So you're going to find that when you come in, we're really trying to address your particular problem. You, the patient, what do you have? Why is that impeding your ability to have a good quality of life? And how do we change it?
And how long can people go with expecting some results? In other words, 10 treatments, 20, 30, 40?
Here's the deal. I think that's going to co-depend on the time you come in. Obviously, I have had patients who come to me in stage 4 cancer. Well, that's going to be, you have a lot to overcome to get back somewhat of your quality of life. Right?
Yes.
And so we want to help you do that. So that may be the kind of thing where you need 40, 50 treatments. Then again, I have the young man who came in. He said he was coming in for detox. He knew about it. He was surprised, though, how much information I wanted from him because he said, I went to another spa-like place, and they didn't want anything. They just put me in the chair. So they gave him a one-size-fits-all.
All right, we're coming up on our first break of the morning. Our program is called Health Watch. We're here every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. Good time to call is early. We always tell you that because people do call, and we have a minute left of the show. We really can't answer your question. So if you want to call, now's the time, 855-839-1210, 855-839-1210. We are returning more of today's Health Watch after these words. Back here on Health Watch, operator standing by right now at Innovative Medical Associates. And you can contact them at 856-489-0505, 856-489-0505. You have a question, you want more information. Most importantly, what you can really do to help yourself, make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and you do that by calling 856-489-0505 and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. You've heard us talk about her. Now you're going to actually hear her live on the show. The lovely Linda is here.
Hey,
lovely Linda. Good morning. Welcome.
Good morning,
Hi, John.
Linda.
Hi, Dr. Molly. How are you?
Good. I'm very happy that you're filling in for me today over there.
Yes, taking care of your patients from Indiana, 11 hours away. They're going home today.
I know that. I hope everybody's doing okay. And as you know, I
She
tried.
feels wonderful. She slept great. Her eyes are so bright. She looks terrific.
Linda, you know why? All because we delivered regenerative type medicine to her yesterday, right? And I got to thank everybody, including you. When you think about our protocol, she came to us with very, very severe symptoms post-Lyme.
Yeah.
I mean,
she's
severe.
young too, right?
Very young,
Yeah.
very young. I think
Yeah.
she's in her 30s, right? Lovely
Right.
Linda?
She's in her 30s for bad autoimmune issues, yes.
Yeah, and she had complete dysregulation of all her immune system. And I will tell you, it took quite a while for us to get her where we have. But now we have some new tools in our bag. I can't even begin to tell you. We have some light therapy. We have, of course, the regenerative groups of products. So it's a good thing, right, Linda?
And
I'm
Dr.
very
Molly,
happy
yes,
you're there.
Dr. Molly, she always feels good, but I'm telling you, this is because usually you have me take particular care of her.
Which I want you. I hope you're taking particular care of her now. I know you are.
Absolutely. It's a feedback on the radio, so I'm in the room looking at her.
Okay, very good.
This
very
light
good.
therapy really pushed her over. I mean, she really has come a long way from that light
It's
therapy. It made a
infrared.
difference.
That's why. And it's a very unique. Aren't we using it in a very unique way, which we can't talk about on the radio?
No.
But I would love to show people when they come in and see us. It's actually the utilization of particular laser. And it's knocked out, right, lovely Linda? I love it. I love it. And I
Exactly.
took time to really understand it. And we have so many new things that we're using in addition to our hydration, including the EPAP. And also we're using some of the vibrational
Yes, we had a
methods.
patient who came to us the second time she was in was yesterday, a lovely woman from Ocean City. And we used the vibration therapy on her. I'm not just saying this. Chiropractors, pain doctors, within one treat, she's moving her arm, she's moving her leg. She wants to come back. She goes, forget the IVs, even though she loved the IVs. She goes, I want that vibration. She's walking. She just cares
know
about
that.
walking.
Good.
I know that.
Yeah.
And it's the combination, Linda. It's what we're using, of course, to help with the joint pain, the bone pain, and utilizing this. That's why, this is funny that you called. You know that it'll remain nameless, but there's a commercial during our hour for a chiropractic particular modality.
Yes.
And didn't the guy come in to see what we were doing? Because we obviously had an impact on some of the patients he couldn't help. So
Absolutely.
it was,
And,
wasn't it?
on a side note, I do that myself, the vibration therapy, and I love chiropractors. I've been going to them since I've been 9 and a half.
too.
But I haven't gone to one in a long time. I do my feet, my hands, my back, my neck, and it
telling
really does help.
It does. And you know what? We love chiropractic. Don't kid yourself,
Yes,
right?
yes.
And
I know.
And I do. I'm just laughing at the manner in which he decided to come in. Okay. He
Yeah.
didn't need he didn't have to have subterfuge, right? He should have just said,
Right.
listen, Dr. Molly, I'd like to get some information from you. But anyway,
Right.
it's okay.
I just wanted to call and say we're
Thank
taking
you.
care
Well, thank
of
you.
good care of
Thank
your
you.
patients.
Thank you.
you, lovely
Thank
Linda.
you, lovely
Please
Linda.
give
All right.
my very best to Melinda and her husband to go home and tell them that I'm really thinking of them, and we'll have a nice meeting this week, phone consult, okay?
All right, Linda, thanks a lot for the call.
Thank
Appreciate
you.
it.
It's an interesting thing because she is working in there, and they're just wonderful people who came up. Honestly,
from Indiana. That's
right,
not exactly around the corner.
No, they had an 11-hour drive.
Right.
What do you think of that?
Yeah.
And we've had people fly in, etc. So when you're talking about autoimmune, one of the things I want to talk about is we've been inundated with COVID-related issues. And invariably, what I'm finding, how they're talking about the long haulers?
Yes.
The long haulers. Invariably, if people have the long hauling syndromes of COVID, and I'm seeing this with people who've just started with me, they invariably end up with certain autoimmune syndromes. And it's blowing us away. I mean, even the conventional physicians at this point know that it could happen. And when they talk about being long haul, they could mean maybe 2 years, maybe longer. I have a patient right now who was diagnosed with POTS, P-O-T-S, and if you're Italian, don't think it means that they're crazy, right? Because you ever heard the old Italians would say you're pazzo, but
yeah, exactly.
But this really is a condition that is it's very interesting because it's the letters of the postural orthostatic tachycardic syndrome, hence the initials POTS. But it involves the autonomic nervous system, which actually controls many things in the body, including heart rate, blood pressure. So it goes up and back. So this poor guy has had he's young. He's absolutely had a terrible time since his COVID exposure, and he definitely tested positive. He has the antibodies at this point. But his life is miserable. So what we are doing, we're putting him on a program of hydration that I'm tweaking for him that I hope helps in the long run. Very interesting thing is he's only in his 30s, and I will tell you that his testosterone levels were in the single digits, John. Single digits. So that in and of itself was an issue. And of course he went the conventional route, and the endocrine guy said, well, he needs shots of testosterone. I agree with that. I mean, obviously we have our physicians involved. They agree with that. But the idea would be to help his body get re-regulated so that he can utilize whatever we give him on the outside to the best of his ability and improve his functionality. And that's what we do at our place.
Is this POTS similar to autoimmune?
It is definitely similar to autoimmune, and they really don't have much in the way to help a patient with this. So what they suggest is exercise, which is something, of course, we promote. They may use some medication. They suggest changing their diet. Isn't that interesting?
Yeah.
Nutraceuticals, high antioxidants. You have to look at giving him something that might help with the control of the heart rate, that kind of thing. But I have to say, he's following the diet very strictly. He's on certain nutraceuticals, both orally, and I'm trying to mimic those as much as I can and enhance their outcome. So he has a long way to go, I'm going to tell you.
I was just going to ask you that because this is kind of a new thing because the whole COVID thing was new.
Oh, yeah.
So this post-COVID, some people are hanging on to this, unfortunately.
Unfortunately, these symptoms, and they're obscure symptoms, they can hit people, so you're not really sure what they are. And in fact, some of the patients who've come in to see me were told by their family physician, "Oh no, it's in your mind because of the COVID." No, it's not in their mind. It could be in their mind. It's affecting their autonomic nervous system, which is in his mind. So yeah, but it's real, and people who are suffering from this ought to come in and see us and see what we can do to help them improve the quality of life.
I guess it's too early to tell, but what's the prognosis for this? I mean,
they can have some symptomatology ongoing. For example, we all know that the lungs can be scarred from COVID, which then decreases how much oxygenation you get. I mean, there's a lot of things that may happen depending on where you were when you contracted the COVID, right? I'm talking about health-wise. So, yeah, I mean, this is look, let me tell you, COVID may be over, but it ain't over till it's over.
That's right. I guess that was my point. That like, when is this going to be over? Because
Post-COVID's around, John.
Yeah,
you got to be careful.
people still are having the long-term effects of it.
That's why they're calling it long hauler, and
Right.
they mean long hauler.
Yeah.
So, but we can definitely improve your quality of life. Come in and see us, and I know we can help you.
All right, we're coming up on our halfway point of the show. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Good time for you to call in if you have a question or a comment for Dr. Molly. You have a particular medical challenge you want to run by her. This is a good time to do that. We do have some open lines here in the studio. 855-839-1210 is our number, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Back here on Health Watch, operators standing by right now at Innovative Medical Associates. A lot of times we talk about things and you say, well, how could I find out more? Well, you can make an appointment to sit down with Dr. Molly. The initial consultation is complimentary. You can do that right now by calling 856-489-0505, 856-489-0505. You can check out the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. And don't forget, if you miss any of today's show, or you simply want to hear it again, we have our Health Watch replay, Sundays 4 until 5 p.m. That's this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. Health Watch is the show right now, our live version, and we're going to go to the phones and talk to John and Marlton. John, good morning. You're on with Dr. Molly.
Hey, John.
Good morning, Dr. Molly and John. How are you guys this morning?
How you doing, John?
It's my favorite bar.
Yeah.
Hey, John.
Well, what I wanted to talk about is you're talking about the different formulas and all you have. I know every week that I come in, well, and not just me, but everybody else, you come over and how you doing? How's this? How's that? What effects you having? And I was having a little different problems, and you change my formula constantly.
Sure.
But the main thing is, you says, I want a list of everything you're taking, John.
Right.
And so I wrote a list out, and I brought it in to you, and you took it over to Barbara. And so I had an appointment with her last week to go in and talk to her after my treatment. I had a list that I never realized. Since the 2.5 years I've been coming there, I'm off of 12 different kinds of medication and vitamins that I was taking that I shouldn't have been taking.
Well,
12 of them. And not only that, I was with her for 1 hour, Doc.
I know that.
She was going over everything. And you, not just her, and you.
Listen, I love Barbara. I just said to John, Barbara went in today. I have these people came in from out of town,
gosh.
John. She's in there today. They didn't want me to drive up today. They said, hey, you need to be fully present for Monday and Tuesday. There are big days. I said, no problem. I said, really, I feel badly about it. No, because otherwise I drag John up to the office to do the show. But you know what? I have a staff that's just wonderful. And you give me, let me tell you something. It's people like you, John, that not only keep me in business, but actually allow me, you give me the privilege to helping you. And I don't take that lightly. I really don't. It's a privilege to work with you.
I mean, I haven't, I haven't been to a doctor in 2.5 years, except my heart doctor.
That's what you need.
I don't have any. When I have a problem, I come in. I say, Dr. Molly, this is this, and you take care of it.
I discuss it with my docs, and we get it done.
Right,
but you know what, John? We really love you, and we know. But you also take good care of yourself, and that's the key. In other words, you're a very smart guy. When something's not quite right, you jump on it. You don't let it fester. We don't allow ourselves to go downhill. And let's face it, after a certain age, we got to stay on top of our health, John.
Yes,
so I want you to, again, know what a privilege it is to know you and to help you with your quality of life, my friend. Thank you.
It comes from this end, too.
God bless you.
John,
Thank
thanks
you,
a lot for the call.
You.
Appreciate it.
Now,
we have talked about this forever.
Yeah.
People taking, and John's a patient, people taking supplements and things, 12.
Right.
12 that
Right.
you eliminated.
Right. And I will tell you, again, we're not against this. As I told you, I have a very smart guy who's a patient right now. His name is Ray. He owns a health food store, one of the few independent ones I think that are left. He's very, very intelligent, but he is intelligent enough to know that he wasn't just getting it quite where he wanted it to be. So what did he do? He called up, he came in, sat with my docs and myself. We're helping him with a knee problem or arthritic problem, and he is kind enough to bring his wife in this week who has a neurodegenerative problem, and we're doing two different types on their family, two different types of hydration protocols. So he's smart enough. Now here's a guy that has at his fingertips any health food product you want. He knows the difference between bad ones, good ones, and in between ones. Yet he chose to come the route of hydration because he knew we can extract the particular constituents he needs for his wife's mental clarity, keep her going, and for himself. And we're trying like heck to make sure that his quality of life improves. Wonderful people.
All right, 855-839-1210 is our number here in the studio, 855-839-1210. I know, Dr. Molly, you wanted to talk about your patient, Sandy, which is a good case.
Sandy's been my patient for quite a while. And Sandy has arthritic conditions, but she has rheumatoid arthritis, which means it's absolutely bona fide autoimmune. This isn't that just because she overused her thing. She has a whole history. Parents had a history of this. And I have to tell you, we started to give her our protocols that actually entail utilizing some of the cells you get from placental products and using regenerative products on her. And I have to tell you, I was shocked at how much better she's doing. Now, when you have rheumatoid arthritis, you have other problems. You can have cardiac conditions. So what did my wonderful docs do? They sent her to a good friend of our clinic who's a very well-known cardiologist. He also checked out what's going on, making sure that the cardiac function has not been impaired. Actually, she's doing very well. We got a preliminary report from him saying she's doing well overall, and that's what we want to do for all our patients. So when I say that we have the ability to send you for additional studies, etc., we can, because we have physicians, we are a primary care, and we try not to let anything slip by us, anything.
You've often said, and people have said this to me, and I can attest to this, Dr. Molly knows everybody.
I know a lot of people,
doctors
good
here,
or bad.
Doctors here, doctors there. I mean, referrals. I mean, you've sent a patient to Houston.
I did.
I
did.
Yes. So, I mean, your network is far and wide.
Yes, it is. And I really try my best to make sure that a patient is seen by the appropriate specialist. And then what we want to do, because we are conventional in our mind, we are conventional. We say, okay, if you need to be on a certain drug, let's put you on that. But again, let's go as judiciously as possible, not to have the side effects. I don't think that's wrong, John.
No.
You're a good example of that. Here's the problem. Lots of my people, Sandy's challenge is one. She has rheumatoid, but it affects certain systems.
Yes.
But I have people who come into me that have had cancer. They then end up with cardiac issues. They then have something else. There's always
You're
something.
describing me by now.
Well, no. How about diabetes?
Yeah.
That's one. Because, when you have diabetes, it's multifunctional. You're going to end up having a problem in various components of the body. This is what happens. So what we want to do is look at the body as a whole, not just zone in on one area. We want to give you relief in the area that's giving you the most trouble, but we don't want you to fall victim of ignoring other symptoms.
And that's why, it pays for the people to do the initial consultation.
Exactly. And
because
then we
that
can
kind of
talk.
opens up the world
dialogue.
for you. Yes.
Right. And we can talk. And when John tells you that I go out and talk to people, I'm doing that on purpose because I get information. I gather information between visits, and I can say, hey, listen, one of my docs, I can say, hey, listen, I think we have a problem. I have an example. One of the docs in our clinic prescribes medical marijuana. Okay. And, that's great for pain relief. Well, I have a patient who needed some pain relief. I hooked her right up with the medical marijuana doctor, who then was in the consult. We were able to get things done and be done with it. Had another patient who started with me, and he was afraid that I didn't do blood work. I didn't do blood work on him initially because I checked and made sure he had blood work done. He had blood work done, I think, within 4 weeks of our visit. And if I had redone his blood work, which I would do to mix up his mixture, it would have cost him extra money. Why would I want to do that?
Exactly. So the blood work that he had before was sufficient.
But what I did was I just ordered it. He didn't bring it with him. I just ordered the blood work. Done. So, here it is, right? I ordered a copy.
But I as I said, it all starts with the initial consultation.
Exactly, John.
And that's where it could lead to wherever it leads.
He needs to go, right? And you'd be surprised. You may think you're coming in for one issue, and in the end, it may be an entirely different road we go, because putting together the physicians for the consult, putting together all your laboratory data, et cetera, it's,
And how many times has that happened where people come in and they say, well, I got this, and then they'll say something, and you'll say, wait a minute, what about that? And then it leads into something else.
Right.
But
so
what can the expectations be? I mean, I know you've had people like myself 20 years and other people 10 years and whatever.
It depends.
What's the expectations on the average?
I think the expectation has to be improvement in your particular quality of life, whatever that looks like. For example, I have a patient right now who is an active cancer patient. She actually goes up to my consulting oncologist in New York City, and our physicians here and myself do her follow-up and her nutritional support. This week, she wasn't feeling very well after her treatments in New York. Well, we ran the blood work. We realized that the hemoglobin, which is very important, could add to anemia, was lowered. So what were we able to do? Because we are a medical facility, we were able to deliver a traditional product that is delivered by hydration, along with the nutraceuticals. We improved her hemoglobin by 2 points. She can go back up and get the traditional treatment she needs from the oncologist this week because we were in the case. That's a big plus.
And we should also mention that you're not against the traditional situations that you may occur.
No, and I have cancer patients who don't want to do any traditional. That's okay, too. I had people who flew in from Florida who's done traditional. They're coming back in 2 weeks to do follow-up with us because now they're feeling fatigued, etc. We're going to help them through that and get them back without any judgment on which way you want to go.
All right, we're coming up on our final break of the morning. The show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. Couple of minutes left of the show. If you want to jump in with a question, we still have time, 855-839-1210, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. More Health Watch after these words. Back here on Health Watch, operators standing by right now at Innovative Medical Associates, 856-489-0505. You want to make that appointment for the initial consultation, which is complimentary. Now's the time to do it. You don't want to delay to get your situation back in order. 856-489-0505. 856-489-0505 is the number. And the operators will be there well after we leave you at 9 o'clock, so don't worry about that. They're there all day, all right? 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. We're going to go to Sewell, New Jersey, and Maureen. Maureen, good morning. You're on with Dr. Molly.
Good morning.
Hi, Maureen. How are you?
Hi, good morning. I'm okay.
Good.
I had a question about psoriatic arthritis. I have been recently diagnosed, and I have had progressive loss of my hand. And was wondering, I've been doing the traditional. I'm a nurse. I've been doing the traditional route.
That's great.
It's only been 6 months.
Right.
It's only been 6 months, and I'm losing my hand function.
What medication? What are they putting you on right now, Maureen? What?
Well,
What's the,
I've done multiple steroids for 4 months,
sure.
which stopped that. Then I went to sulfasalazine, methotrexate, and now they're looking at the Humira.
Hey, can I ask you a question, Maureen? How old are you? Just curious.
60.
You're a baby.
60.
Oh, hey, Maureen, come in and see us. Those drugs, you know the drill. I mean, obviously, what they're trying to do is depress some of your own immune response because your body's in a state of over-inflammation. You know, it'd be interesting. I have several patients. In fact, one is glaring at me. She's a paralegal. I'd love to put you in touch with her. She has the same exact issue that you have. It does take a little time nutritionally to help. We did not take her off of her medication quickly, but my doctors did wean her down because, the end result on the Humira, there's a lot of side effects with that as well. And you already lived through the steroids, you know it. So, come in and talk. There is a certain nutritional component of this, and if we follow the diet and use some of the hydration as a vehicle for some of the constituents, I think we can help. Can't cure it, you know that, and my doctors will tell you the same thing. Can't cure it, but we can help and maybe get that hand back into use and cut down on some of that inflammation. And read a little bit about some of the nutritional supplements that you should be taking, and we can also guide you in terms of the better brands, okay? That's something I would want to help you with. Go ahead.
Thanks. I already take a lot of supplements, and I've had no issues really physically up until this year. And I've been in great shape, no problem. Still working, even though I have limited hand use. However, I do take a lot of supplements, and I'd be curious to see if the supplements that I've been taking match up to what you're taking.
I would definitely want to help you with that. Listen, we love our nurses. As you know, I have several registered nurses that work with us. And, I know what you guys do. God bless you. And we really, really would love to help, I'm sure. Okay?
Maureen, good luck with that. Thanks for the call.
Do it. Thanks,
Good
Maureen.
luck.
Yeah, you see, she's intelligent. She already knew to get on the supplements.
Well, and how about helping her with the supplements? We had the call earlier, John.
Yeah,
where you
absolutely.
You got him off 12 of them.
Right.
So she may be in the same boat. Not exactly, but similar.
Most time nurses are pretty knowledgeable.
Yeah.
Go ahead.
Okay. Mike is in Moorestown. Mike, good morning. You're on with Dr. Molly.
Hi, Mike.
Yeah, how you doing, doctor? I was just wondering, what is your success rate with? My wife was diagnosed in March with breast cancer, stage 3 breast cancer.
How old is she, Mike? How old is she?
She's 57.
Oh man, she is a baby. Here's the thing. I can't tell you we cure breast cancer. You know that, but I can tell you that we have more than several actually, patients who are in our chair who have breast cancer. Did your wife go the traditional route? Has she had a surgery and everything, or?
Well, she had the lump removed.
Good for her.
A lumpectomy. But, it was just, we're kind of talking it over about either going the Orthodox way or trying something different.
Here's the thing. You don't have to be so arbitrary. You can go the Orthodox way and still do some of the things we do. You're not that far away from us. You're a great candidate. You and your wife should come in and talk to us because she should be following a certain amount of regimen no matter which way you go. And I'm very happy that she had the tumor or the lump removed. That's step one. And John will tell you, and all my patients will tell you, if you can get it out, you get the beast out. And then we, work with you to help you, get to the right type of traditional treatments, those kinds of things. Please come in and see me. I'd love to talk to your wife, really.
I mean, I was just trying to find out. Have you dealt with other people with the same situation? And
absolutely. I can't give you a success number. I'm telling you, we can't cure cancer. I can tell you that I can put you in touch with several of my patients who would happily speak to her. One patient calls in several times here who did no traditional treatment, but she was very strict with her diet, very strict with taking supplements, and she's doing well. I have other patients who I've helped direct them to a surgeon to remove the actual tumor. They're doing well. They also have opted for certain traditional treatments. So it really depends. I can't say we cure cancer, and I'm not going to say that. But I can tell you that we can give you a good quality of life no matter which way you go.
And I was just going to say that,
Okay,
Mike, that I've witnessed some of the patients that Dr. Molly's talking about, and it improves the quality of life. That's really the issue. Yeah.
Exactly.
Yeah.
And
feel free to call in, Mike, and
we'll
get
have
that.
the doc sit with you too. Thank you, sir.
Okay.
God bless you.
Feel free
Good
to call
luck.
that number, and we'll give it out again, where you can call and schedule the initial consultation.
You know how tough it is for a husband to be sitting there talking about. Of course,
I'm sure.
he wants to know.
I'm sure.
You know, I don't know if anybody can really give a full success rate on cancer. As you know, John, our belief is that lots of people need the help going through traditional treatments to stay around. I can say one thing from my own observations. I have patients who started with me, didn't want to do the traditional route. They're not around now. I've had patients who've done nothing but the natural route, and they're not around. The patients I've seen that does sort of a combination of two in one way or another, they're around.
They're around, right.
So I don't know. That's the bottom line.
Yeah, I think the issue, and we always talk about this, is you're attempting to improve their quality of life.
Right.
And with cancer, especially with the chemo patients,
right,
you help boost their immune system.
I think we use what we try to do is use an appropriate nutraceuticals, not to interfere with no matter what conventional treatment you take. And I think the idea is he's smart, though, to be looking at it now, because you don't want too much time to go by. That's the bottom line.
Okay, you've got 2 minutes. I know you want to talk about MS patients.
Yeah,
what do you think?
You know what? We're doing a lot of work with MS patients, and right now, of course, everybody knows that there's such a thing as a specific MS diet that you use, nutraceuticals. And using the nutraceuticals, meaning certain B vitamins, etc., and certain dosing that can help the MS patients. Well, indeed, they do. We also use a subclinical dose of a particular pharmaceutical product, very tiny dose compared to what a traditional dose would be. And we're finding that our MS patients are doing well. And as you know, I have a medical director who has MS, and she's doing pretty well given her situation. So yeah, there's hope out there, and the earlier you get in and the earlier you start following the diet and you get some advice and you use some hydration, we're having some good luck with
Well, that's the key for everything.
Yeah,
the earlier the better, right?
Absolutely. And look, quality of life is the key. We can't cure, but I have great physicians. They do a good job. We get to the bottom of whatever the issues are, and we want people to be like our friend John here, who called in and was, he's doing well. And that's it. That's what we can do.
And again, the thing is quality of life, and you don't cure anything. Of course, no one cures.
No, I
right?
don't know. Maybe they do, but we don't.
Right.
Okay, what
Exactly.
we do is give patients a quality of life no matter what their medical challenge is. That's what we're all about.
And that's, I guess you would say, is the success rate.
It is.
Of helping you improve your overall quality
Because
of life.
there's nothing worse than having a cancer diagnosis, walking around in fear and inertia. No, you want to have everybody on your side, and you want an arsenal.
That's right.
You want an arsenal.
And you help provide that.
Well, we try.
And with that, we are going to wrap up another edition of Health Watch. Don't forget, operators standing by at Innovative Medical Associates, and they'll be there well after we leave you this morning at 9 o'clock. 856-489-0505, 856-489-0505. That's the number, Innovative Medical Associates, Marlton, New Jersey. And don't forget the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And if you missed any of today's show or you just want to hear it again, don't forget our Health Watch replay this afternoon, 4 until 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses Jess and Crystal, I'm your host, John DeMasi. Thank you for listening. Have yourself a great week and a healthy one. We'll talk to you next Sunday, 8 till 9, Health Watch, Talk Radio 1210, WPHT. You take care.